food. Oh. Okay. So we have some goals today, and so I guess what they've asked us to do is. She okay? Okay. Okay. So we've got lumbar facet, sacroiliac, and then we have piriformis, cervical plexus, the medial branch, third occipital, and caudal. All right. Now this is all spine. Does anybody else want anything else?
Qualcuno vuole
Other requests?
altre locazioni? Cioè, volete vedere qualcosa in più a proposito della colonna?
Mentre siamo in zona the occipital nerves.
Greater occipital. Okay.
No.
Greater occipital. Anything else?
Pudendal nerve.
Okay. Pudendal. Pudendal nerve. Anything else? Sounds like plenty, huh? Okay. So what I'm going to do is what Marco and I are going to do is what we want to do first is just do some spinal anatomy. Okay, so we'll just do the spinal anatomy, and then we'll go from there. So that'll be our goal. So first thing we're going to do is we're just going to look at the lumbar spine, and we're going to see the spinal canal, right, with the sets, and then Marco's going to do the Italian here. So, you know.
Allora, facciamo un overview delle cose che andremo a vedere, cioè cosa stiamo per vedere, anatomia, diciamo, di riferimento, le faccette articolari.
Very good. Okay. So we got the facets, spinous process, transverse process, spinal canal, and then the vertebral body, right? Okay. And so we're going to have to recognize some things. And so one of the patterns that I use is there's this W. Okay, so spinous process, facet, transverse process.
La W sarebbe il processo spinoso, le faccette e il processo trasverso.
W.
W.
Okay, so in the W,
in questa W adesso ci considererà dove passa la branca mediale.
the medial branch.
Branca mediale.
It's right there. So so we're going to find that, and then we're going to try and recognize the. Okay. We'll see the. So we have the nerve roots and the lumbar plexus.
Le radici nervose che poi vanno a formare il plesso lombare.
And then we're going to have the psoas.
Muscolo psoas.
And then we're going to divide the psoas into 3.
Dividiamo lo psoas in tre parti.
Because this is where the lumbar plexus is.
Il plesso lombare è a quel livello.
Okay. And then you have aorta, vena cava.
dipendendo da dove stai scansionando, aorta o vena cava.
aorta. And then here be the sympathetic chain.
Catena del simpatico sulla parete anteriore del corpo orbitale.
All right. So we need to learn all that first, and then we're gonna see the sacrum,
Adesso il sacro.
and then so we're gonna have. This is gonna be, if you do this way. All right.
Sacro.
Sacrum. And and then that's going to be the trend. So we're going to have here we'll have the hiatus.
Iatto sacrale, il corna del sacro.
And this is a sacrococcygeal ligament.
Legamento sacro-coccigeo.
Yeah. So we want to go there. Okay. So once we
Noi ci dobbiamo passare attraverso.
Oh, green, not good. We don't use green. Okay, hi. All right, so so then once we get that lumbar spine, we get that anatomy down, then what we're going to do is we're going to try and divide that. So what we'll have is the sacrum and the iliums. These are going to be much bigger. Okay. So what we want to do is we want to look at the spine in long axis. So what we're going to do is we're going to look first here at the lamina.
Prima in asse lungo andiamo a guardare per prima cosa la lamina.
And then they're going to be so there's going to be the lamina, and then
Queste saranno la figura di come vedremo la lamina.
And this is the vertebral bodies. And so you'll see what we call the horses' heads.
Abbiamo il cavallo, le teste di cavallo.
And then you have here will be the ligamentous flavum.
Legamento giallo.
And then the posterior longitudinal ligament.
Legamento longitudinale posteriore.
Okay. And then this will be the dura.
La dura è quella tratteggiata.
Okay. So, and then inside, and inside here will be the cauda equina.
Il cauda equina, canale sacrodurale.
Okay. So that's going to be the first slice, and then the second slice is going to be the facets, and
La seconda longitudinale saranno le faccette. Sarà più esterna la seconda visione.
so we're gonna let's go the other way. have the, what we call the tile roof. This is the facet joint, the facet joint.
Queste sono le faccette articolari.
And that'll be the, or this line. Okay, so that'll be a little bit farther.
Un po' più lontano laterale
And then
rispetto alla prima.
the next is going to be, so, and then, so then this will be this is the pedicle,
Pedicolo della...
and then this will be the nerve.
Qui dovremmo vedere il nervo.
So this is so you're going to have, so here's the nerve. So we're going to do the next slice. Okay?
A quel livello vediamo questo tipo di figura.
And then the last slice is here. And that's going to be our transverse process.
Questo è lo pezzo.
So we'll go from lamina to lamina, which is spinal canal. So lamina, spinal canal, to facet, to nerve root, to transverse process. Okay. So we're gonna go from so this will be the lamina, and then this will be then these will be the facets, and then this will be the nerve root, and then this will be the transverse process.
Chiaro, no?
Okay?
Sono tutte le stensioni longitudinali, a seconda del livello della stensione più o meno para-mediano, vediamo diverse cose e in ogni livello c'è una sua specifica funzione.
Okay. The ultrasound. Yeah, the ultrasound guy, so he can control the machine.
Okay, I call him.
Okay. Cold.
Molto meglio.
Okay, turn the Doppler off. Doppler off. Okay, so we're a little less depth. All right, there we go. Let's start there. So you can freeze. Okay, so if you look at the probe,
Se guardiamo la sonda,
so the important thing is it's, to do the first sacral foramen, you have to be at 35-40 degrees.
per vedere il forame, se il primo forame sacrale, dobbiamo stare inclinati a 30-40 gradi.
So when you're doing, you have to go, so L5, L4, L3, L2, L1.
Cioè la inclinazione cambia a seconda di cosa vogliamo cambiare.
And then you go, sacrum, hiatus. Hiatus, sacrum, 5, 4, 3, 2, 1. Okay? So, now this, I usually start with this picture. I'm gonna try and, I start with the sacrum to get to, so you know where the bottom is, because the most important thing is to know where L5 and L4 is, since that's the world, as far as back pain.
Si parte dal sacro per sapere poi a quel livello, poi si prosegue per capire il livello.
Yeah. So, So I'm just gonna, again, I'll go and over this and we'll go over it, so don't worry, but, so if this is the middle of the sacrum, and this is the ilium, and this is ilium, this is the sacroiliac joint, this is the S1 foramen.
Forame di S1.
Okay, go, explain it to him a little bit.
Explain?
In Italian, yeah.
Allora, abbiamo visto l'articolazione sacroiliaca, è veramente chiaro, non credo. Volete che traduco? Allora, abbiamo visto, è il sacro, siamo al livello della metà del sacro, diciamo, grosso modo. Abbiamo l'ilio, l'articolazione sacroiliaca e il primo forame sacrale.
So,
Questo livello.
so S1 is like this.
Cioè il primo forame sacrale è obliquo.
S2, S3, S4. So they have a. So the nice thing is to find one, which is important, is to know that it's not straight down. It's more like this.
Il primo forame è inclinato, i secondi saranno più invece diritti.
Okay. Okay, we can unfreeze. Okay, so so now I'm going to go down, and as I go down, so we have one. So then you're going to see, as I go down the sacrum, see the hiatus.
Lo iatto sacrale,
There's the cornu,
il corno del sacro,
and then this is the sacrococcygeal ligament,
legamento
Yeah.
sacro-coccigeo,
and then this is S3,
S3,
and then if I keep going down, then I'll have, S4, but that's the hiatus here. So now my probe is almost straight, and now I'm going to go down, and now you can see I'm going to keep going, and then can I have some more depth? More depth.
un po' più di profondità,
And now, in a little more depth, there we go. And then, there, okay. So, sacrum, S1.
S1 del sacro.
Now when I go, then I drop off, and
Scendo un
now,
attimo,
hit freeze for me, please. So this is the posterior longitudinal ligament.
legamento longitudinale posteriore,
So this is the vertebral body,
corpo vertebrale,
and then this is the nerve root.
questa è lì passa la radice nervosa.
And then this is where the facets and iliolumbar ligaments.
Legamento ilio-lombare,
This is the ilium, and the
Ilio.
ilium. Yeah.
ilio,
Okay. So so you can unfreeze. And so there's that. So this is the vertebral body.
corpo
And you can
vertebrale,
see the spinal cord pulsing.
la pulsazione della corda spinale,
Now I'm going to go up one more. So now that's going to be L4,
adesso siamo alle 4,
and then you can see the facet,
faccetta articolare,
and then the facet, spinous process, transverse process.
processo trasverso,
Okay. And now, can you see my W?
W,
Yeah. All right. So now I'm going to go one more.
ancora più in alto,
So now we have facet and facet,
faccetta,
and this is spinal cord, or this cauda-equina,
la cadequina dentro il canale,
and then this is the W,
ancora la W,
and then there the medial branch.
branca mediale,
And then you see the cauda-equina pulse,
cadequina che pulsa,
and then now I'll slide over,
andiamo un po' più laterale,
and then psoas.
muscolo psoas,
Okay? And then you can see there's bowel.
l'intestino,
And a little more depth, please. And now you can see as I go down, I've got aorta, vena cava.
i vasi, aorta, vena cava,
There's aorta, sympathetic chain,
catena del simpatico,
psoas,
muscolo psoas,
lumbar plexus,
plesso lombare,
quadratus lumborum.
quadrato dei lombi,
And you can see the transverse process.
processo trasverso.
And then you can see this is that W, and then the spinal canal here. So now what I'm going to do is I'm going to go back. So spinous process, facet, transverse process, quadratus lumborum, psoas, body of vertebra, sympathetic chain, vena cava.
Stessa cosa dall'altra parte,
And then this is the psoas.
muscolo psoas,
And you divide it into three,
è diviso in tre,
lumbar plexus,
lumbar plexus e qui.
right there. So there goes the nerve right in there. So
Le
that's,
radici passano in quello spazio lì,
and then there's the W,
nella W,
and there's the medial branch.
branca mediale.
Okay. And then we go back, and we see the middle.
Nella-
Now
Metà.
what? So what is this?
Che cos'è questo?
Posterior.
Longitudinal ligament. And what's that little line above it?
Che cos'è questa linea sopra?
The dura.
Dura.
So that's the anterior epidural space. And then the ligamentous flavum is here. And then this is the dura here.
Questa è la dura.
Okay. So that's, and again we can go over, see the W, quadratus lumborum, psoas, and now we have kidney.
Il rene.
So now we're almost, and now here's a rib.
Questa è una costa.
And now back to kidney, and a little psoas, quadratus lumborum, and now transverse process. So that's in short axis. Then we're
In
gonna go,
asse trasverso. Adesso in asse longitudinale. Quindi vedremo quello che
so now I'm gonna go in long axis. So I go in long axis, and when I do, you can less depth for me, please. There we go. That's good. So now it's
Adesso-
important to look at the probe
guardate bene la
because I'm
zona.
angled, and now I'm gonna paintbrush. I'm not gonna do this. I'm gonna do this because you need to look at the spine mostly like this until you get to the transverse process. Understand?
Cioè questo è il movimento per vedere il
People
dentro
go-
e poi andare su
People go too straight, and they just try and do this, where you need to come out, spinal, see a lamina, transverse process, or facet, nerve root, transverse process.
Incliniamo la sonda per trovarci poi lateralmente tutte queste strutture.
So here's so you can see, there's the cauda equina,
Coda equina,
and this is your lamina,
lamine,
and then, so you can keep going down. So this is 5, 4, 3, 2, 1, and 12. And that's the conus. So this is the start of the cauda equina. So this is the epidural space. There. All right. Everybody's got it? Yep. So now just a little bit more. Just a paintbrush, just a little more. And now facets.
facetti articolari.
So this is your inferior articulation, and this is your superior. And this is a joint. This is a joint. Joint. Joint.
L'articolazione del processo articolare inferiore e superiore.
Okay. So if I go back, there's the lamina. I go to the facets, and then I don't see anything down here.
Non vedo niente sotto.
That's the facet, it's the roof. So there's no, you know, that's important because if you see anything, now your needle can epidural or, you know, no, you don't, nothing good. So the facets. Now I'll go slightly more. I'm gonna paintbrush slightly more. So we'll have lamina, facets, and now nerve root. Nerve root.
Le
Nerve
radici
root.
nervose.
Okay. So turn the Doppler on, please.
Vedete bene?
Doppler on, please.
Mettiamo il Doppler.
And move the box down. Okay. And those are the arteries for the nerve roots. Okay. Right there. So now let's no Doppler. Take the Doppler off.
Togliamo il Doppler,
Okay, so we go back. We have lamina,
lamina,
facets,
faccette,
nerve roots,
radici nervose,
transverse processes.
processo trasverso.
And if we go farther, no transverse processes.
Non
Okay.
più, è finita.
So-
L'osso è finito.
So the thing is when no transverse processes, nerve roots, facets, and an epidural space. Okay? So that's good. So we're going to split up and we're going to just work on that. Okay? So let's just half go over there, half come over with me, and then we'll practice doing that.
Adesso ci dividiamo e tutti quanti proviamo queste cose che abbiamo visto qui di vederle sul modello. Ognuno le deve visualizzare.
Come on, let's go.
Faccio
The aorta's down here, lumbar plexus. See? Nerve root coming out. Now we go to the W.
W?
There's the W.
Ah, okay.
And then there's the medial branch right
Middle
there.
branch.
Okay, now you do it.
Okay.
So S1. So remember, S1 is going to be, and just remember, L3 is straight down, but you're not straight down till L3. So it has to be 4, 5. Okay, so if you're counting, if you've got sacrum, you've got to be about 45 degrees. So there's 1.
That's one.
And now,
Okay.
there's 5. Not too much. You want to, in other words, you have 3. So look, paintbrush.
Okay.
See? Not this. This. Okay, so 3, 4, 5.
Like
See?
paintbrush.
More. There you go. Like a paintbrush.
One can study the angulation of the single lumbar vertebra
Yeah.
from a previous longitudinal scansion.
Uh-huh.
Okay?
Yeah. Okay. So there's sacrum. Fifth lumbar. Fourth lumbar. Third lumbar. 2. 1. See, spinal, this is the cauda equina. Right there, anterior epidural space, posterior epidural space. Okay.
Good vision.
See, yeah. So go.
Easy young.
Yeah. And now you're gonna go. Yeah. So now you're gonna go. Now stop.
Okay.
So kidney,
Kidney.
quadratus lumborum, psoas. So
Lumbar plexus.
That's a kidney. That's a vein.
Questa è quella
Yeah, it's a
vena
vein.
renale.
So now go down, go caudal, down. So now we're gonna do this. We're gonna keep a little bit of an angle. So there.
Okay.
So there's the lumbar plexus and the nerve root. So go down 1 vertebra. down, there. Transverse process, facet,
Facet.
and now nerve root, psoas, lumbar plexus, quadratus lumborum.
For the W?
I'm sorry?
For the W.
W. No, the W is going to be where the transverse process is. There.
Yeah.
Up, there. Then we don't quite have,
Okay.
but that's part of it.
Okay.
And now
I
we're
see.
off the W. Now go down. There's another W. And down.
Down.
Call it there. Lumbar plexus.
Lumbar plexus.
Right there.
Okay.
Now you just go out there. And now you see bowel, lumbar plexus, quadratus lumborum.
Bowel.
Okay? All right? So yeah, one more thing. I'll take that. Okay. You get that? Okay. Next person.
I can see it's more simple, a longitudinal scansion, to
understand.
study the angulation of the
Sure.
single vertebra,
Yeah.
and this is interspinals, interspinal.
These are spinous processes.
Okay,
And then
spinal plexus,
interspinous
Okay.
ligament.
ligament.
And then the spinal canal's down here.
Now I have later lumbar vertebra.
Now we have S1.
Ecco, the first,
S1.
okay,
And
sacroiliaca,
then you,
okay, sacroiliaca,
let's go over.
okay, eccola, well, very well, okay, okay, this, okay,
And then
The
if you want, now I'll show you something else. If you want to see sacral inferior SI joint, you see ilium
yes, è chiaro, sì,
joint. Ilium
ilium joint,
joint,
okay,
right there. And if we go this way, ilium joint.
a joint,
See, either this is a
What is it?
high SI,
huh?
low SI.
Lower side, okay.
Okay.
The we can the needle,
Uh-huh.
the entrance of the needle
Right
is
there,
this,
right
is
there.
this. Okay, right there.
Or you can
Or-
go high SI,
Huh?
and the needle,
Yes, but
That
this
way.
is more difficult. Yeah, it's
But-
more longer.
but more
longer.
more common.
More common.
Yeah.
This is
That's where people. It's more people.
street,
More people
more-
hurt there. So the
This is
bottom.
more
The
simple.
bottom is easier. That's why the fluoroscopy does it there. But
okay.
but that's not where everybody hurts.
Okay.
So let's go and do the fifth lumbar, fourth lumbar.
Okay. This first lumbar. This is a facet
Facet, right
interarticular,
there. Yeah.
interarticular. Okay.
And this is spinal canal.
Spinal canal.
And then this is
Longitudinal ligament.
ligament.
Okay.
All right. Now let's go up one more.
Up one more. The second.
Now you can see there's the spinal canal
Okay.
again.
The facet. Here.
And then you're going to have, and if you just,
Eccola.
there, see? So,
Eccola.
so here's what you learn. You learn, look at me. You learn to do, look at me. You learn to, Point.
Ecco, sì.
See.
Angolation, così.
Ok.
yeah, now you can see. And the same thing, if you come here, there's my W.
Sì, W, ok.
And now medial branch.
Sì.
And then facet.
Facet,
Mammillary process.
sì.
And then transverse process, quadratus lumborum,
Sì,
psoas,
SOS,
lumbar plexus,
sì.
sympathetic chain, aorta.
Ok. Ok.
So,
Faccetta.
yep.
Interarticolare. Ok. Allora andiamo su.
Okay. Spinal canal.
Spinal canal.
So let's go over here. And there's my W.
W, ok.
And there's the medial branch and the facet, transverse process, quadratus lumborum, kidney,
Yes.
psoas, vena cava,
Sì.
lumbar plexus, lumbar plexus. Okay, so let's go along axis.
Longitudinal way you don't use for the needling.
Oh yes, I do. I do longitudinal for facets and for epidurals and facets. And I do this for
This is spinosa,
yeah.
lamina.
No. And
no.
here's what's important again. Spinous process, yes.
Okay, spine.
Too many bones. Watch this. You come out.
Ah, ho capito.
Tutto inclinato.
Quindi inclinare verso l'interno.
Sì.
See?
Capito.
Lamina,
Lamina.
facet, nerve root, transverse process,
Oh, ok.
lumbar plexus,
Capito.
no transverse process.
Ok, ok.
Transverse process,
Transverse.
nerve root,
Nerve.
facet,
Facet.
lamina, spinal
Spinal
canal.
canal.
Okay, but
See?
the use of
Yeah.
you use this scansion and the ingress of the needle here.
Mhm.
Okay.
Yeah, and for facets, I go
Do
look,
it out of plane.
I go facets. I can
Like
see,
this.
see if we do the like here's facets right there.
And the
Then
angle of
then,
this.
no, then I go with the needle, and I can do
Così.
I can do 1, 2, 3.
Yeah.
One
Ok.
needle.
Ok.
So I go 5, 4, 3,
Sì, perché segui là.
and then
Sì,
now
yeah,
that's
sì.
that's
Perché almeno
epidural.
This is the space interfacetal.
articola.
Questo qua. Ok.
Yeah. Now
Capito.
go a
E
little
sali.
bit lateral. Go a little bit lateral. Now.
Quindi è angolato così.
Yep. And now go a little more lateral. Let's see the nerve. Oh, there. There's a nerve.
No? Ancora più.
There's a nerve root
Sì.
right there. You can come in here off the pedicle, and then do the selective nerve root, or off the pedicle to the nerve root.
Il nervo, sì, sì, sì.
See the nerve root.
Sì,
There's the needle.
sì, sì,
There.
sì, capito.
Okay.
Ce lo facciamo.
Grazie.
Yeah. Here you go. Here.
Grazie.
I just keep getting a new one. Right there. Okay. So I think it's really important to come down and really find the sacrum, and then this, because I'm gonna show you what I do real quick. You'll have your turn in a minute. I'll just show you real quick. Trash can, huh?
Ci sono in nonna. Sì, questi giusto.
That's why I went to the bathroom. I stole those from the bathroom, the toilet. So when I'm going to do a procedure, it's always important to know where the sacrum and where the caudal hiatus is, and where the sacrum is, and then where L3 is, because then if I mark them, then I know, even if I'm going this way, I'm like, okay, so I'll show you.
Vuole
Ah,
segnare.
yes, dermografica. Sì, perché non si fa il
So that was close, huh? No, damn. Okay, got it. No worries. Okay, so there's hiatus, right?
Gli fa solo il segno così.
There's 1,
Ah, vedi le conte.
5.
Spinale.
Somewhere, Joe.
La professionale spinosa.
1, 5, 4, 3. Okay. So I know L5 or and then this is L3,
Yeah.
and this is this is
S1.
caudal hiatus, because this is actually, S. It's very small from, if I go from hiatus, and now fifth lumbar. So this is S1,
First
Yes.
number.
L5. See, so then I know, and then what I do, many times I do this, I go here, let's go on this side. So this is, and I can check 5, 4, 3, see, 5, 4, 3, and I go 5, 4, 3, and then I go, and I can say lamina, facet, nerve root, transverse process. So it's very close. There you go. I'll even show you. This is my, look. So here's, when I do patients, this is my patients. So I do the drawings. And then,
Ecco, quindi lo fa.
then I have, then you can see the marks.
Ho capito.
Lo fa per lui.
Trying to see
Lo fa
Dunque fate questo che...
more
Vedi,
marks.
fa il disegno su-
Marks. Doing the front, back. Those are all patients.
You always do it.
I always do it. See.
You sign always patient before needling? Yes, always.
Always. Just everyone. It's faster, because once you map, make it you
It's
make
more
a
simple.
template.
The template is
Then when I clean, then I just probe down. I don't have to go look. Now I can just go. No playing. So once it's clean, because I don't use gel, I use Clark.Prep, no gel. I just clean, probe down.
Ah, prima la cella.
no, pulisce la parte laterale, poi fa le
Poi
scansioni,
si
poi
vede.
fa le...
Poi appoggia l'ago e la sonda e basta.
Five.
Una volta così, appoggia la sonda sopra per non già senza dare fare.
però,
Ah,
Four.
ho capito.
però poi dopo penso che rimette il gel
Three.
e rifaccia, perché non è così
Set.
facile poi entrare tipo nella sacrovia che
Transverse process. That's my W. Quadratus lumborum. Psoas. Lumbar plexus. Body of vertebra. See? So lumbar plexus. So now I'll show you what I do. I do a lot of discs. So now you leave it here, like that. Spin the probe. Discs.
Eccolo, il disco.
Disc.
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 Sì, certo.
Disc.
Ah, di là.
Disc. So I do discs as well.
Ah, ci arriva di lato, sì, certo.
So if anything I'm trying to teach you is that angle, L3, because that's when people, they just like, I don't understand, and they just don't have the right angle,
So this is the lumbar plexus.
Lumbar plexus here. Okay, so this is probably, and this is bowel, quadratus lumborum, psoas. Okay, So now let's go longitudinal. There you go. So we're going to go out. See the lamina, the sets, nerve roots, nerve root,
And when is a
transverse process, lumbar plexus.
And you can block the lumbar
And then
plexus.
lumbar plexus, nerve roots, the sets, epidurals. So epidural. Okay. Sure.
Questa è una macchina.
And one more person. No, I'm gonna give you one more go.
Poi riesci a vedere come vedi la sonda che ne
Sì, io l'avevo studiato, però farlo dal libro e poi farlo così effettivamente non riesci a trovare tutti la carriera. No, ci avevo provato, non è così facile. Infatti io quel punto della sempre lì e ancora adesso utilizzo la guida radiografia.
So remember, now look,
E comunque
here's L3.
tosta, perché comunque
That will be,
quando
you'll be down then,
entri,
straight down.
poi
But here, look, there. No, don't look up there, look here. 3. No, look here, no, don't look there. 3, 5, sacrum. 5, 3. All right? So you see the paintbrush. That's 1. L5. L4, facet. And L3, facet. Facet and the W. And then quadratus lumborum, psoas. W. Lumbar plexus. W. See? Right there. Psoas, quadratus lumborum, lumbar plexus, nerve root, sympathetic chain, aorta, breakfast. maybe dinner. Depends, you know. There you go.
sta dormendo.
That's 1.
Così non respiro direttamente.
5. 4. 3. W.
Nerves.
Body of vertebra.
Yeah.
Nerves, lumbar plexus, quadratus lumborum, psoas, then erector spinae. Hidden.
Scusi.
Nervous is this. Okay.
And the nerve
okay.
comes out, and then this is the plexus.
Okay.
So they come out, then turn.
Yeah. And sacroiliac.
Yeah, so sacroiliac. Yes.
Okay.
So ilium,
Yeah.
sacrum. So if we see L5, and then we have S1, sacroiliac joint.
Okay. Okay.
Sacroiliac joint.
Okay.
Now if we go here, watch the ilium drop away. Go down, 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 then joint.
Yeah.
And if we go here, down, 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 joint.
Yeah.
And now, no ilium,
No.
joint.
Okay.
Right there.
Okay. Okay.
All right? And we go long axis. So,
Ecco, vedi, l'angolo, io uso l'angolo molto inclinato.
lamina,
Yeah.
see the angle?
See.
And now, facet,
Io ho fatto
Sì.
sulla cervicale si vede benissimo.
nerve root, nerve root,
In realtà questo è un ragazzino,
transverse process.
quando vuoi figurati.
Ho capito.
Yeah. So the only thing the only thing I didn't explain is when you're going from lamina to facet to nerve root to transverse process. Only thing I didn't say was this. L3, L5. This a little bit. They're a little bit wider. So you're not going like this. You're kind of going bottom, wider on the bottom, because the lumbar plexus is going like that. It's more like a tree, a little tree. So facet is a little bit wider on the bottom. And now transverse process, and then there's lumbar plexus. Is that okay?
Okay.
All right. Okay. Anybody else? Or are we done? Ah, one more person. Okay. He's a lefty. All right. I'm married to one. Hiatus.
Yes.
S1. L5.
Yes.
4. L3.
Okay.
W.
Yes.
Okay. Quadratus lumborum, psoas, lumbar plexus, W. Now here comes ilion. Kidney.
Yes.
Semplice.
No, è che non sta sulla pancia, che non riesce a farlo stare giù.
Con tutta la adiposità dei muscoli, la generazione dei muscoli, la carenza ostica è tutta diversa.
S1.
A little more up, up. There. See?
S1.
Oh, no, S1 there. Now if you go up more, L5. Drop, keep going, and keep going,
Sì, io lo faccio sul margine.
keep going. 5. See the?
Okay.
See this is the lumbar, longitudinal, so all the way through. Now go to 4. Facet. There's L4. There's the post longitudinal ligament here. Now go to 3. Up. And
Yeah.
3.
Okay.
Keep going up a little bit, a little more. Ah, that's a facet right there. All right. Now go lateral. There you go. So here's my W. Up. No. Now. Ah, there. Perfect. And the
Okay.
facet.
Yeah.
And then spinal cauda equina.
Yeah.
Now go down, a little bit down. And now psoas and lumbar plexus. But it would be easier if you were a little more. See?
Ah, okay.
See, now you see the body and the plexus a little bit better. Quadratus lumborum. Now, if you hold that right like that. Okay, you can take that away. No, one, you stay right there. Stay there. So I want to you can hold. I want to show you this. Somebody hopefully speaks good enough English to understand this. Do you see this?
Yes.
3. So we call it the shamrock.
Trifoglio.
Do you understand?
Trifoglio. Shamrock.
Shamrock. So, I'm just saying. So
The
yeah.
Irish.
Yeah. So yeah, I'm Irish. So a little bit Italiano. No, but yeah. So okay, just want you to understand. Okay, so now go long.
Ah, iris della lamina.
Lamina.
Ok.
Facets,
Yes.
Io sono radiologo.
nerve roots,
Con le terapie fisali.
Così si vede
transverse process, nerve roots, facets, lamina.
Yeah.
But you see the angle, huh?
Yeah.
Okay, you do it. Lamina, facets,
Yeah.
keep going, lateral, more lateral, more nerve root. Now think here, like I said before, a little bit out like a tree. Understand?
Understand.
And now transverse process, lumbar plexus. And now you go back to nerve roots, and now facets, epidural, canal. Okay?
These are the transverse process.
No, those
No.
are this is the nerve roots.
Ah, okay, okay.
Now go more lateral.
Oh, okay.
Abbiamo sempre pensato,
Now lumbar plexus.
Yeah.
Keep going lateral. More. Now no transverse, just
Yeah,
psoas.
Yeah.
Okay.
Okay, thank you.
Sure. One more.
Last one,
Okay,
I
good.
think.
That's good. But
con la coda della sintomatologia.
hiatus. And then just keep the angle. And then that's ones. Yeah.
Yeah.
Fifth lumbar.
Continue.
There. Go. 4. You gotta come in the middle.
Yes, middle.
And there's a facet.
That's it.
Facet.
Set.
And then over. W.
And a moment, just a moment, sorry. Okay.
Now
Only
we'll
the
go down.
right.
Now watch.
Okay.
One more W. W. W.
Keep.
W.
Yes.
This is quadratus lumborum. This is psoas, lumbar plexus, nerve root.
That's it.
Facet, yeah. Lamina, facet, nerve roots, transverse process, lumbar plexus. You see, you just lamina, facet,
Set.
nerve root, lumbar plexus. So you're out here
Yes, yes.
going like that. Yeah,
Yes.
Please show again the shamrock.
sure. So show us the shamrock.
Grazie.
Ah, scemo, sorry, ho capito. Scusa, il trifoglio.
Scusa, non volevo.
Okay. Psoas, quadratus lumborum, erector spinae. So the only thing I do is
Okay, okay. So only
more angle.
more angle.
Yeah. And then you can see the bone and the muscle, all three muscles, and the lumbar plexus. Okay?
Okay.
All right. Good. Okay, let's come back.
Metà scoprire la polmonare della
think you saw some caudal, a little bit of caudal, a little
Un po' di
bit.
caudale,
You know, I saw a little bit of sacroiliac joint.
sacroiliaca,
We saw some lumbar facets. We saw some medial
mediale.
branches. And we saw some nerve roots.
radici nervose,
And we saw some lumbar plexus.
questo
Okay.
non va.
So now what I'm going to do is I'm going to go. We're just going to go down to the piriform. We'll do the piriformis
Adesso andiamo al piriforme
and the pudendal.
e al
Okay.
nervo
So
pudendolo.
that'll be our next goal. So I'm going to go through the shape, the shapes again. So
Le forme.
so got the hip, trochanter. So now.
Ah,
So now what we're going to do is we're going to go over. We're going to learn the next thing, and we're going to go along the ilium, and we want to learn the ilium, and then we go to
adesso, andremo lungo l'ileo.
we go to the we'll go from the glute maximus, glute medius, glute minimus down to the piriformis,
Fino al piriforme.
and then eventually we'll go to the ischium, where we'll see the obturator internus, which I think is more important than this piriformis. Everybody treats piriformis, but once you use ultrasound, you find that most people have an obturator internus problem, not a piriformis problem.
È
So
più importante forse l'otturatore interno che il piriforme, però vediamo il piriforme, ma forse anche l'otturatore interno che forse è più importante clinicamente.
yeah, so because piriformis is here. So this is piriformis. So we're gonna take the probe, and we're gonna go down. We're gonna go down, and as we go down, all of a sudden, we see the notch, and the greater occipital artery will come out. So I use the greater occipital artery as my landmark, because the first thing to come out of the sciatic notch is the greater, or the superior gluteal nerve and artery, the artery. So we'll look for that. And then we'll see the piriformis. So we'll have the probe like this. But now we have to take the probe and we have to pivot. Italiano.
Dobbiamo pivotare la sonda,
Okay.
rotarla.
So this is the important thing about the pelvis. Oh, wait, have him come back, just for a second. No,
Beccato subito.
seriously.
Riccardo ti rivali dietro
One
subito.
moment, just 1 minute.
Un momento,
1
un
minute.
momento.
Yeah, no, you're good.
Beccato subito.
He's good. I just want to,
Scuola.
so I just want to show what in my group. So caudal pay, sacral SI, L5, L3, and then then we have lamina, facet, nerve root, transverse process. Okay. Okay. Yeah. So we need to pivot down to find the piriformis. So here's the important thing about doing the posterior hip. Everybody thinks that things come from the spine and go across, but actually everything comes from the trochanter and goes out. So it's this and this and this and this and this. The pivot point
Il punto principale
Di estensione.
pivotale è il grande trochantere.
Yeah. So this is piriformis. This is obturator internus. Quadratus. So we have minimus, medius, maximus, piriformis, superglamellae, obturator internus, inferior glamellae, quadratus femoris, obturator externus, you know, but they all come from the trochanter.
I canali trochanterici.
And this is where they, you know, they can't sleep, they can't sit, and they have this
Non
pain.
possono sedere, non possono dormire perché hanno dolore.
And so I want you to learn the piriformis, and I also want you to learn the obturator internus. Then I can call this my waterfall.
Che lui lo chiama la cascata, perché si vede che si butta dentro alla pelve.
So when that happens, you know, then we can see. So we have the sacral plexus,
Plesso sacrale,
and then it becomes the piriformis, the sciatic nerve,
nervo sciatico,
and then it goes down. Okay, and then the posterior cutaneous thigh comes down.
posteriore della coscia,
And then in between that,
tra di questi,
where this ischium is, between the piriformis and the ischium. Okay, so the piriformis, no ischium.
se c'è piriforme non c'è l'ischio.
Okay, then when you come down,
Andiamo giù,
then you see, so piriformis, as I'm moving down, so, okay, so here. Now when I get to the ischium, it looks round.
sembra rotondo, diciamo.
Okay, then when I go down a little bit more,
Andiamo più giù,
then it flattens out.
diventa piatto.
And then it rounds back down.
E poi invece diventa piatto che trova in giù.
And then it becomes very small.
Sono tutte forme dell'ischio che ci riconosce a seconda del livello.
Yeah.
Prima rotondo, poi diventa piatto che va in su e poi piatto che va in giù.
Questo
E poi diventa l'ischio.
Quindi a parte scheletrica, stiamo parlando del repere scheletrico.
Scheletrico, l'ischio, esatto.
Quindi repere
L'osso.
ecografico scheletrico.
So,
Bone, ischio is bone.
bone, yeah, bone.
Bone.
That's when you're
Ischiatic bone.
yeah, the ischium. You're sitting on it, you know.
Noi ci sediamo sopra l'ischio.
Yeah.
Sì, sì.
So yeah, and this is just piriformis, but so in the beginning, it's going to be a little bit round, and then you're going to have this point on it. This is the spine, ischial spine.
Ischia spine, cioè quando va l'ischio piatto che va in su è la spina ischiatica.
Ah, capito.
Sacral, spinous ligament.
Legamento sacro-spinoso sulla
Uh-huh.
spina ischiatica.
Okay? And now this is then this is going to be and this is your
Sacro
tuberous,
Legamento
sacral tuberous ligament. And this is pudendal nerve.
nervo pudendo.
So between the sacral spinous ligament and the sacral tuberous ligament, the sacral plexus, the perineal and tibial become the sciatic, right? And then the pudendal goes out and back in through the two ligaments.
Dal plesso sacrale lo sciatico segue una direzione e invece il pudendo va verso la spina
And then this
ischiatica.
is your hamstring.
Questi sono i muscoli posteriori della coscia.
Okay. So we're going to see that this is going to be obturator internus.
Otturatore interno.
Okay. So piriformis, sciatic, sacral spine, sacral tuberous, and then conjoint tendon for hamstring. Okay. So we're going to go over that now, so we can learn that. But just another thing in my life, we're not going to spend too much time today But if you think of the gluteus minimus
gluteo minimo,
and then the gluteus maximus, or medius,
medio,
and then you have the gluteus maximus. Okay?
gluteo massimo,
This,
grande gluteo.
the important thing here is
Importante lì cosa? Nervi cluneali. Cluneal nerves.
superior cluneal nerves.
Nervi cluneali superiori.
So this is L3, this is L2, this is L1. This is really, really common
È molto
to be pinched there.
È molto comune che siano schiacciati lì.
And then everybody thinks it's sacroiliac joint. You do sacroiliac joint, and it really doesn't help. It's just on the PSIS, posterior superior iliac spine, not the sacroiliac joint, just lateral to it, right there.
Si vedono ecograficamente?
He is asking, we can see them with ultrasound.
Yes, and here's the important thing. You can see it comes out between
Loro escono
the maximus
tra il grande gluteo
and the medius.
e il gluteo medio.
So,
Si riconosce.
so you can see where the two muscles stop, and then there's a notch.
C'è una incisura dove si può vedere passa il nervo.
And I think it's even simpler than that. The patient points to it.
Molto
They-
più facile che te lo dice il paziente dove
They just
gli
point
fa
to it.
male.
They just go right there. Please fix that. You know, and you put an X on it, and then you put the probe down. And you're like, oh, that's it.
Sono branche dell'ilio lombare, sono branche di quel...
Sono L1, L2, L3.
appunto, L1 e
What's
L2
the origin of the
of the root.
of this nerve, of the cluneal nerve?
L3, L2, L1. Okay, so the middle cluneals are S1, S2, S3.
Ah, yes.
Inferior cluneals, S3, S4, come in this way. Those are your inferior cluneals, middle cluneals, superior cluneals. But this L3, really, because a lot of post-surgical backs have L3 problems, and then a lot of people have L3 problems, and they say they have this radiating pain down their leg. And then you fix this, and the radiating pain goes away, because it wasn't their disc.
E la terza branca
Se
che
tu lo aggiusti lì non c'è più il dolore che si irradia in basso.
ma tipo sciatica? No.
No, dico, sì, è un dolore che si irradia ma non va,
Riccardo.
non va alla gamba, ma si irradia. Cos'è? He asking is like sciatic, radiculopathy for sciatic radiculopathy going to
Absolutely.
through the
L3.
but going to
Yeah.
the
Yeah.
foot
Yeah.
anche addirittura may mimic may
Yes.
looks similar to
That's why I'm saying, you know, we do the L5 nerve root, it feels better. But we do the lumbar plexus, it feels better. But you're just going up. Where's the problem? Then you do just that, and it's gone. So sometimes it's just the pinch of the cluneal nerve.
qualche volta il problema è prendere questo nervo cluneale e risolto il problema.
And I think
diciamo.
you probably agree. Do the sacroiliac joints have radiating pain?
La sacroiliaca può avere un dolore che si irradia.
How fragmented do you think is this problem?
Very, very, very frequent.
Molto.
And I think, you know, when we were just in my group, we were just talking about how many people do the inferior SI joints. But most people hurt it in the high SI joints. So I teach how to do the high SI joints, because I think that spot, you know, from high SI joint to cluneal, you know, those two spots are the most common in the world, and everybody goes, well, it's L5, it's L4. Yeah, and a lot of people, it's discs, L4, L5. But when they have the pain here, it's cluneals and sacroiliac joints.
Which is the best thing to do, I mean, in diagnostic?
Well, to me, you always should go diagnostic, go as far down, because if you block here, you don't know where the pinch is.
Cioè,
But if you go down farther and it helps, then you know it wasn't here. So I always go peripheral first.
Cioè, prima lui va, diagnosticamente è meglio fare qualcosa in periferia finché tu non trovi dove è il problema. Perché se blocchi sopra non sai sotto se il problema è più sotto.
So if it's if it's here, then I'll do the perineal nerve here first, and then if they say, okay, that feels better, but I still have this, so you're always trying to,
But the compression of the nerve is possible from the large and the medium gluteus? Is possible here?
more than possible, like most common.
And two injections of the anesthetic
Yes.
in this point
Yes.
Resolve the pain?
Yes. Now, the anesthetic may resolve the pain because it numbs the nerve. But again, I made this word up 25 years ago called hydrodissection.
Aiutami.
Allora, l'anestetico ti risolve il problema perché addormenta,
Certo.
ma però lui non fa quello, lui fa l'idrodissezione, la tecnica di liberare il nervo dalla
Quindi
dal
perineurale per
You push 10 cc's, 15 cc's, 20 cc's, maybe of just 5% dextrose, maybe just saline with a little bit of lidocaine, maybe a little bit of steroids, but it's mostly volume.
volume di liquido, un po' anche di anestetico, ma su salina o destrosio, salina o destrosio, o fisiologica o fruttosio 5%.
Because this is, I think like this is very tight. And if I open it up,
Un po' di
it will
cortisone.
slide. So I'm trying to open it up so it'll slide. Okay, let's go. Okay, nose down.
Benissimo, io faccio il disegno.
Tom, can you sign this one, please? Nobody can reproduce this.
Mi
This
sembra
is
giusto.
it's everything there.
Giusto.
Oh, ora
Fantastico. Andiamo tutti a firmare.
come interview, yes.
Tutti a fotografare.
I should be going.
Yes, much better. Much better.
Okay. Alrighty. I need the other gown. The blue gown. This? No. I just want this.
The blue,
la
la vestina, la cappa blu.
Quindi a me che mettiamo due.
No, si chiamano nervi cluneali, anche in italiano.
Vuoi sentire questi nervi?
Sì, no, ma sono tre tipi.
Superiore, medio inferiore.
Esatto.
Questo usano solo presente bene. E non è proprio
Nervi cluneali, no?
Ci devo cercare.
Okay.
Io il suo libro, se non sbaglio, lui ha scritto un libro su tutta questa cosa qui.
Okay. You get to sit back down.
Ok.
They need to see. Alrighty. Hold. Maximus, medius, minimus, superior gluteal artery.
Quella che cos'è?
L'arteria gluteo superiore.
Back over. So now we have, watch where the maximus is going to disappear.
Il gluteo comincia a scomparire mentre lui va in
Sì,
giù.
sì. Adesso sta andando su.
And then, so you're going to see, as it goes away, then that's right where the cluneal nerve is going to come out.
dove i nervi cruneali escono.
Yeah, right here. Because this is sacroiliac joint,
Questa è l'articolazione sacroiliaca,
and that's superior gluteal nerve.
nervo
Gluteo superiore.
The
gluteo
Gluteo
superiore.
superiore.
Right here. Because see, this is right where the maximus
Yes.
goes away. Nerve.
Quando il gluteo massimo scompare,
C'è
lì
il nervo.
Okay. So now I'm going to say, so here's your, can I have the Doppler, please?
abbiamo un po' di Doppler.
And then down there. There. Okay. So that's the superior gluteal nerve artery.
L'arteria glutea superiore.
No. No.
L'arteria gluteo superiore che è il ramo della ipogastrica.
We can go on until half past noon.
Okay. 12:30 noon. Okay, so this is superior gluteal artery. So let's take, so I always find the superior gluteal artery because the next thing is going to be the piriformis. So turn the Doppler off.
Prima va a trovare questa arteria perché la
Doppler
prossima cosa che si vede
Il piriforme.
andando in basso è piriforme.
Okay, so now I'm going to slide down. I'm going to see a big black muscle.
Un grosso muscolo nero,
È proprio.
piriforme.
Piriformis. Okay? So now look at the probe. I'm going to pivot down to go line up with it. See, this is not, that's pivot with it.
Muove un po' e gira la sonda per mettersi in linea con il piriforme che è un po' obliquo.
Piriformis. See? Yes? And now you can see as I go, do you see the hip joint?
Articolazione
Sì,
dell'anca,
dell'anca.
So this is your hip joint. This is your trochanter.
trochantere.
So you can see piriformis. And now what I'm going to do is going to switch. Okay. So we went maximus, medius, minimus, superior gluteal artery, piriformis. So now this is sacral plexus and this is bowel.
Questo è l'intestino.
Okay. No good nerves. Okay. So now what I'm going to do is I'm going to go down a little more, but watch the bone.
Guardiamo
See,
l'osso.
remember here?
Sì.
Sacral plexus
Sì.
and the bone. And as I go down, you see it get flat with the point. Flat with the point. Yes?
È piatto.
Turn the Doppler on.
Mettiamo il Doppler.
Doppler on. Move it over. Pudendal artery and nerve. Sciatic nerve. Is your descending branch or your inferior gluteal nerve, and this is your pudendal artery and nerve. And now this is sacrum, sacral spinous ligament, sacral tuberous ligament, sacrum, spine, and that's pudendal, sacral tuberous, sacral spinous, sciatic.
Upper is the
This is
gluteo.
maximus.
This is the maximus.
Yes.
Okay.
This is
And
maximus, and then this is your superior gemelli.
This is,
Il
cosa?
gemello superiore.
Il?
Gemello
Ah.
superiore.
Okay? So now, once you see that, you find the pudendal in that ups, can I have the Doppler off, please? Okay, and a little more depth. Okay. So now I'm going to look for the next thing is the waterfall.
La cascata adesso.
Wonderful.
Cioè l'otturatore interno.
See the waterfall? So that's the obturator internus. Obturator internus tendon, muscle,
tendine e muscolo.
hip joint,
La
right there,
articolazione dell'anca,
sciatic nerve,
nervo sciatico,
posterior cutaneous thigh nerve,
nervo cutaneo posteriore.
and that's waterfall. Can I hit freeze? Will you hit freeze, please? So, everybody talks about, I started practicing in 1978. I'm old, and for 20 some years, I thought I was treating their piriformis.
Per tanti anni lui ha pensato di trattare la sindrome del piriforme.
Then I started doing ultrasound,
Poi
and I could palpate and mark where they hurt,
guardando dove loro hanno male
and then I put the probe down, and it wasn't their piriformis.
e dove la gente ha male non è il piriforme.
Obturator internus.
È il dottoratore interno.
So now here's how we approach this with the needle, and we have to come in from the midline
Si viene
this way
dalla
we have
linea
to come
mediana,
in
cioè
here.
lateralmente.
because we have the nerves, so we can't come in this way.
Non possiamo venire dall'esterno perché sennò c'è il nervo sciatico, il nervo
And when you
cutaneo posteriore.
when you do this, many times they go, oh, that's exactly it.
E quelle volte che lo facciamo non
But-
sappiamo dove esattamente siamo,
But they also feel, because the pudendal lays over the top.
noi feel because
When you go in with the needle, the pudendal is laying on top of the obturator. When you put the needle in, all of a sudden they go, ooh, funny place.
loro ti dice il paziente dove quando raggiungi col lago il muscolo ti dice eccolo il dolore.
And then the next thing they say is I never really told you that, but I feel that with sex and other things too. They don't want to tell you in the beginning, but then when you reproduce that, they're like, yeah, that's a problem.
Very private.
Yeah. Yeah. So they don't tell the doctor. They just say, it hurts in here, but they can't say that it hurt. It's painful to have sex or whatever. So
It's just one point of view.
yeah.
Evidentemente parla di uomini, diciamo.
It's Italy. You guys are a little more, I see the lingerie all over the place. Okay. So glute maximum over the top, postcutaneous thigh, and sciatic nerve, obturator internus, hip joint. So the next thing down is going to be the ischium. It's going to be where the hamstring attaches. And the reason why I wanted to go over that is because when you have the tendon muscle, hamstring pulls over your lifetime, you actually start to get a spur.
C'è una escrescenza, insomma una...
You grow a spur there.
asiatica, sì.
But here's the problem.
Qui c'è il problema.
Obturator internus
Is moving there.
is getting pinched by the spur.
Può essere preso nello spunzone, diciamo, se c'è un'escrescenza ossea può essere compresso.
Aiutami a fargli una domanda. Molto spesso io ho trattato senza alcun successo le sindromi da dolore dell'attacco degli hamstring, non ho mai avuto successo.
I said that he is a pain therapist and he treated many people with problem with in the tibial tuberosity where the hamstring but never had success.
Because
it was obturator internus.
Why?
Because it was obturator internus.
Perché?
Perché non è il problema lì, ma il problema è nell'otturatore interno.
Because I'm going to show you, because the spur comes and the obturator internus goes over the top.
but the
Yeah.
pain is to refer it into a touch of the hamstring.
It's the
Yes.
same. It's the
It's,
same spot. I'm going to show you. It's the same.
The patient refer, I have pain at a touch of the, but the real problem is in the otturator.
I will show you because the hamstring comes in
Yes?
and obturator goes across. It's
Si
the
passa
same.
sopra. Quindi è lo stesso punto, quindi il dolore viene da lì.
So,
Però non è il problema degli hamstring, ma è il problema dell'otturatore interno.
so the most common thing that happens to me is I teach this to a doctor.
Che lui quando insegna ai dottori,
And then this is what they do. They get on the phone
prendono il telefono,
and they call their wife. Close up. And they say, come in the office, we need to fix the pain in your butt. Because they've already tried the hamstring. And they're like, it's not your hamstring, it's obturator. Come in now, right now. Because they...
Cioè lui ha detto quando che può chiamare subito la persona per fare subito questo blocco per vedere se funziona,
Yeah.
perché
So
hanno
it's
trovato
all-
la maniera per,
It's always
per
the
risolvere il suo problema che apparentemente
It's
era
always the
risolvibile.
doctor's wife, every time, because they're like,
Cioè,
I don't want to hear
le
about
mogli dei
it.
medici potrebbero avere questo dolore, come mai?
Okay, so let's the last one, then we finish. Okay.
Può darsi
So-
che
So unfreeze. Okay, so here we go. One more time. So maximus, medius, minimus, superior gluteal artery, piriformis, spine, pudendal, superior gluteal, obturator internus, sciatic, posterior cutaneous thigh, hamstring, conjoint tendon of hamstring attaching to the ischium right there. Quadratus femoris,
Sì.
sciatic nerve, obturator externus. Conjoint tendon of hamstring, that's the tendon. Now look at the probe, don't look at the screen. Look at the probe, okay? No, sit down, sit down. No, you gotta sit. So I want you to all see how much the probe moves. So,
dobbiamo vedere quanto si muove
Ok.
la sonda.
so,
Ah, sì.
so
sì.
look at the probe.
Yeah,
Obturator internus, hamstring.
sì.
Just a bit.
Cioè muove pochissimo, voglio dire.
1 centimetro. Un centimetro.
Not even a centimeter.
Just a little bit.
So watch. So this is conjoint tendon of hamstring here.
Sì, sì.
Okay?
Sì. Sì, 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 sì.
Both.
Quello è il quadrato?
Now obturator internus, right? Obturator internus, hamstring. I didn't even move the probe. Obturator internus, hamstring. So if I turn the probe this way,
Se giro la
Sì.
sonda invece,
and you see obturator internus is here. Watch. Piriformis, obturator internus, hamstring.
Non ho capito quello in mezzo. Sotto l'hamstring, sopra il piriforme, in mezzo cosa c'è?
So
scusa, mi sono perso.
So
Piriforme.
piriformis,
Piriforme. Poi?
superior gemelli,
Superiore?
Il gemello
Ah,
superiore,
già sopra il gemello.
obturator internus,
otturatore interno
hamstring insertion.
e l'inserzione degli
L'inserzione degli hamstring, sì, ho capito. Ok.
otturatore interno is a tendon there.
Yeah. So can I hit freeze? Hamstring,
Sì, chiaro.
obturator internus. Same,
Quindi quello è l'otturatore interno.
right there. So it's right where the spurs attach. Okay. So, so now we're gonna go practice. We're gonna do piriformis and pudendal. Obturator internus I think is important too. So, okay, let's go. Back. Go.
Proviamo, dai.
here's piriformis,
Sì, sì.
and here's obturator internus, and then there's conjoint tendon of hamstring,
Sì.
and then quadratus femoris, and obturator externus. But see, here's the other thing. Do you see? Here's sciatic nerve.
No?
Nerve. Sciatic nerve, conjoint tendon of hamstring. Obturator internus. So all three: sciatic nerve, obturator internus, hamstring. That's why it's so painful.
Sciatic
Sciatic nerve.
nerve.
Sciatic nerve,
Sciatic nerve.
obturator internus, and hamstring, all in one picture.
Okay, I understand.
Sciatica gemella.
Yeah, there you go.
Allora, proviamo un attimo a vedere. Allora, this is
Piriformis.
performance.
Okay.
Okay.
So let's go up. Now,
Okay.
So here's Maximus, medius,
and-
minimus,
Okay.
supragluteal artery.
Artery. Okay.
Now we go up.
Up.
Watch the maximus
See,
disappear.
Disappear, and there is what nerve?
Superior gluteal or superior cluneal nerve.
Super conium. Okay.
And then if you go this way,
Huh?
sacroiliac.
Sì,
See, they
chiaro.
think it's sacroiliac, but it's actually can be superior cluneal.
Ho capito. Allora,
Where is the posterior
The
spine?
posterior superior iliac spine.
Yes.
The nerve is on the lateral edge of it,
Okay.
so it's part of it.
quindi lì è l'arteria.
And then artery, and then
Questo
piriformis. And now a
Legamento.
little bit more angle to get the piriformis.
Sì, legamento. Eccolo.
Vede benissimo
All right.
dove
Sì, sì,
vede
sì.
So now when you go down, you see this get
quando è
see it get
piatto diventa la parte alta.
flat
Ok.
with a little point on it.
Legamento.
Yes, it's flat, round, piriformis.
Sì, legamento.
Flat,
Ligament.
sacrum.
Sì.
Sacral spinous ligament,
Spinal
sacral tuberous ligament, pudendal nerve.
But the angle is not better. This for
No,
Par-
because
no,
the
no,
ligament
no.
goes like this.
allora.
E dove come ci va su sto?
Show me ligament.
No, nervo. Sì, ma quello sì, lo scolo, quello ho capito. Perché è più interno e esterno. Così.
This ligament.
Tuberous spinous,
E quello è il
pudendal nerve.
Vai a
In
prendermi
between.
qualcosa da mangiare, sai
And then
che colazione devo
sciatic
fare
nerve.
latte.
Okay.
Obturator internus,
Sciatic nerve. You have a shoulder. Eccolo lì. Shoulder sciatic nerve.
and
Okay.
then obturator internus, waterfall.
Wonderful. And when you treat pudendal, you have seen I before think was the Perioperative syndrome.
Right.
Okay.
Yeah.
After you think this is the obturator
Yeah.
syndrome,
Yeah.
you needle the obturator muscles
Yes.
from this approach, from this needle.
Yes. So if you see the waterfall, so right there's the waterfall,
Okay, from this, so
and you come in
come
at
in
the bone here,
lì,
and then inject here and into the tendon muscle. But you don't want to inject too much because then you block the sciatic nerve,
yes.
and then you have to buy them lunch or dinner because they can't walk.
I cannot to inject in the sciatic nerve.
you
No,
don't. You want to go to the bone.
more,
Right to
more
the- Yeah, right to the bone.
right to the bone.
Hit the bone, and then
Go
inject,
down.
and inject into the tendon and into the muscle.
Okay. Ok.
Not hyaluronic acid.
Vedi che quando ti arrivano che dicono
Hyaluronic acid only
no,
dentro il muscolo, dentro il
Saline or
cranio,
or 5% dextrose.
adesso cerchiamo di farci
Okay, who's next? Come on.
into the muscle, nel tendine del muscolo.
The
L'acqua.
the
Infatti per quello che gli ho detto.
well, or you know, my
Saline,
10 cc's total. Okay, 10, 2 lidocaine,
in 10 salina.
8
10
total. 2 cc's lidocaine,
lidocaine,
8 cc's
10 cc di fisiologia.
saline or 5% dextrose, and then 40 milligrams of Devamedrol. Yeah.
Perfetto.
Now, here's the thing. If you go down to the bone, there's a bursa,
sì.
Yes, poi
and
segui
then
la
there's
borsa.
the tendon muscle. You get the bursa and the tendon, and then you don't come out because then you get the sciatic nerve. Unless, in my case, sometimes I want the sciatic nerve because I think it's pinched there too. So then I use another 10 cc's.
Più giù deve andare.
Lots. I want to open up
Ma io ingetto del
Quando
pulso.
hai visite di
the bursa and the tendon.
devi
Yeah.
stare mediali e andare alla cascata.
Sopra
Come la chiamano?
the solution doesn't
La
go
cascata. Questo è il
Che
che è il muscolo che scende. Il tendine che
Stays
scende.
in.
Giusto.
Because if you look,
Questo è il
it's inside the pelvis, the very big muscle.
Ok. Poi salta.
Allora sali,
Questa è
grande muscolo,
l'emergenza,
medio muscolo
questa
e
è
poi c'è
The
l'arteria.
maximus, and then we go, and then go up,
Abbia pazienza, vai
Invece il
là.
nervo.
and the
È
nerve,
l'entusiasmo.
right in the tip. Sacroiliac joint is here.
Sì.
Cluneal nerve is up top. And now
Quelli
watch
sono
the
i-
maximus. See the maximus get bigger
Sì.
and go away.
Si ricorda.
And now piriformis. Yes.
Sì, si riforma, sì. Sta impallando il dito.
Now pudendal. And you see it get flat, round,
Adesso c'è.
flat.
Sì, sì, sì.
Sacrum, sacral spinous ligament, pudendal. Then here, obturator internus,
Eccolo lì, il tendine
sciatic
muscolo.
nerve. You hold.
Io pungo da lì, vado a finire lì dentro. Ah,
Right
ecco.
there.
Sì, fa ruotare la gamba, si
So
assicura.
the bursa against the bone, and the tendon muscle here.
Nella borsa,
No, a fianco, lì dove si inserisce, lo vedi quando
dove
apre
si
la gamba.
inserisce il tendine sul muscolo, lui arriva lì con l'ago. The needle,
The needle goes to the bone
yeah.
where the bursa is. Then you back up into the tendon, and then inject there too.
Ok,
So both places.
ok, ok. Ho capito. Trovarlo è difficile.
Perché sì,
Trovarlo è difficile.
sono millimetri, a seconda di come muovi già perso.
Ma soprattutto perché lui è un soggetto ecograficamente perfetto, poi vallo a fare in una persona.
Sono meno perfetti.
Dovevamo portare suo fratello.
Maximus, cluneal.
When disappear the maximus?
Cluneal, right there. Sacroiliac joint, nerve, maximus, piriformis.
Extra rotated that.
Wanna pivot that way. Piriformis. Okay. And now you're going to pivot back, obturator internus. And if I will go up, there's pudendal.
Sì, è quello. Here's the
See,
pot.
here's it. Here's
Okay, I see the
piriformis.
Yeah. Should become flat. The string is flat.
There's the sacrum,
Okay, the sacrum.
pudendal.
This
Right
is
here.
the nerve and the heart.
There, yeah, both.
I told you to with the Doppler.
And you go, yeah, and you go down to the bone.
Okay,
And then you aspirate, and then you inject.
okay.
And then obturator internus, sciatic nerve, and hamstring, conjoint tendon, quadratus femoris, sciatic. Let's try, and then you will do it. You will do it many times in the future. Come on.
Too difficult for me, but
It's not too difficult. It's always good. You got to try. So that's piriformis, maximus.
where do you start usually?
I usually
From the
start
top or
on
from the
the ilium.
Okay.
I want to see the ilium, and then I see the maximus go away, and then cluneal nerve. And then if I go this way, sacroiliac.
We have
Sacroiliac joint.
and S1.
And S1, yes.
Oh,
And then we go here, cluneal,
okay.
and then maximus,
Yeah.
and then piriformis,
Yeah.
and then pivot. There's piriformis. Okay, you hold that. Piriformis.
Yes. Yes. I rotate.
Sacral plexus. Okay. Now you're going to go down and make it's going to get flat.
Yeah.
Here it gets flat,
Yes.
and sacrum.
Yes.
Sacral spinous, sacral tuberous, pudendal nerve, and artery. Then down, sciatic nerve now shows up, obturator internus, waterfall, and then go down just a little bit more down, and hamstring, conjoint tendon, right there, quadratus femoris. Just a tiny bit, huh? That's why.
My patients usually have a big fat ass.
Yeah, and that's why we use. That's why we use the big fat ass probe. No. Okay. Yeah. Yeah. So now we have. So we're going to go ilium.
Okay, ilium.
So maximus, medius, minimus.
Minimus, okay.
Maximus disappears. Cluneal's in this here. Sacroiliac joint is there.
Okay, sacroiliac.
Yeah. And then there's the nerve, cluneal nerve. And now we go down.
Okay.
Superior gluteal artery,
Okay.
piriformis. Angle a little bit like that. Sacral plexus,
Second place.
pudendal nerve, or piriformis.
Okay.
Okay. Now we're going to go this, and you see it get flat.
Flat.
Sacrum, sacral spinous ligament, pudendal nerve and arteries, sacral tuberous ligament. Right there, pudendal nerve.
Okay.
Now we go down here, and now we have the waterfall. Oh,
Waterfall. Okay.
and now the sciatic nerve.
Sciatic nerve on
Yep,
the left.
right there.
Yes.
And now we come in here, up against the bone, and inject the bursa and the tendon, and then then go down some more.
Where is the bursa?
It's between the bone and the waterfall. Doesn't have, luckily he doesn't have one, he's too young. And now keep going down,
Down.
down, caudally, down, and hamstring. See, right there. So we'll have a spur sticking into the obturator. Yes. What did you need?
Inevitabilmente c'è più gluteo, c'è più
No.
più spesso.
Però c'è più panicola di
C'è più
pollo.
panicola di pollo più spesso. Quindi...
Beh, la muscolatura suppongo che sia uguale.
No, no, i muscoli c'è più
Vediamo se la
muscolo,
trovo
scusa,
da
ho detto
sola.
sbagliato. Spesso per rimare su.
Vediamo se riesco a trovarlo da solo le cose.
Perché come ti gira lassù?
Già questa è un'anatomia che tu devi ripassare, almeno io mi devo ripassare perché
Cioè vai sulla colonna come abbiamo sempre fatto, tocchi il punto anche là.
Mamma.
Ma perché sono descritti, guarda che li hanno descritti insieme. Adesso li chiamano tutti, anzi, in Italia.
Sì, anche io sentivo, ma
Ce l'ho nella tasca dei pantaloni.
Sì, sono gli scritturali, certo.
C'hai troppo caldo?
No, sono stata dopo. Naso fuoco.
Complessa anatomicamente.
O l'Italia, per forza.
Sì, ma di solito,
Ho involontariamente utilizzato.
cioè, di solito i modelli non sono
Dov'è adesso?
Sì, effettivamente.
Facile a sedere.
Mi sto dentro nudi però,
Nudi per ora, subire.
con brivido scuotente, ma no, stai dicendo, stai
Mamma.
Dimmi.
Tenga.
E mettilo in tasca.
Eh no, non ce le ho le tasche, sai.
Però trovo che sia chiaro come spiega lui il rapporto con il rettore osseo.
Soprattutto che fa l'anatomia schematica. Che vuol dire?
Voi avete fatto 2 foto? Quello di prima.
Mettere i dettagli al
No, ci stiamo pensando.
Ma nella borsa o...
Sai cosa?
non lo operi più praticamente, lo apri, non lo apri più. Lo apri più. Secondo me
Io sì, però tu non ci hai provato con la sua
Io per esempio sono dentro le fisiotopie, inserzione di tipo politiche, uscite la fascia frontale vanno tutti bene al 100% con la prima iniziativa.
Ma di cosa? Di
Ialuronico, cortisonico e anestetico. Sotto guida cortisonico, ma vanno tutti bene alla prima, non tornano più. Li rivedo dopo mesi
A me stanno andando
e
bene anche
qualcuno, un 20% gli rifaccio la Questa invece mi è andata sempre male. Ne ho fatte. Sì, cioè, lui è l'unico forse che a sapere dove cazzo pungere.
sì, è l'unico, non c'è da nessun'altra parte. Ho frugato. Ho frugato pure, ma ho fatto notare.
Ho provato ma non ci sono riuscito.
Piriforme.
Piriforme, no, non ci sei ancora, quello è il sacro, devi andare forse un po' più, se posso.
Sacrum.
Vale.
Sacrum.
Trovi il sacro. Eccolo, quello già è il pezzo, però sei angolato male.
Però sono angolato male, devo
ecco,
ruotare.
eccolo.
Yeah, so that's piriformis.
Eccolo,
Ecco.
quello è il piriforme.
Piriformis,
E sotto vedi che c'è anche il complesso.
flat,
Flat.
pudendal, and now
Okay.
waterfall,
E waterfall. Ok.
sciatic nerve, over the top.
Now yeah.
So if you look at me, piriformis.
Ah, la cascata, ho capito.
sì, la
Waterfall, waterfall.
Dell'ottorato italiano. What the hell is he saying? Then all of a sudden, yeah. Capisci? Yeah. So this is look at me. So piriformis, obturator internus. Not too much, very little, just a little bit, you know. And then, so piriformis, superior glomellae, obturator internus, inferior glomellae, quadratus femoris. Not too much. It's all.
sono uno attaccato all'altro. Scendi giù e qua.
Another thing, you said before that the third clonal nerve.
Yeah.
You have shown me the first clonal nerve, and the third.
Yeah. there's actually 9. There's 3 superior, 3 middle, 3 inferior. but the three superior cluneal nerves go along the ilium.
Along the ilium.
Yeah, I can
but
show.
From the gluteus and another.
Yeah, so from the L3, L2, L1, or S1, S2, S3, or S3, S4 in the
first
bottom.
is upon upper the maximus.
Superior
The
cluneals.
second is from the maximus
through down,
and medium.
the sacrum, and then the other one's around the glute maximus underneath.
Sì, thank you.
So that's the inferior. Inferior, middle,
and
superior.
And the superior.
So 3, 3, 3. Okay. Anybody else?
Sorry, do we have time? Can I be your tester? Because
You want to see? He's like, he's not the injection, what he wants, yeah?
I don't know.
Here's the wait, I'll stay right there. Stay right there. He's like, get the lidocaine out now. Where's the steroids?
Impari tutte stesso su uno che sta ed è giusto partire da una persona con un'ecogenicità molto elevata, tipo Miserale, perché poi ti cominci a fare i tuoi punti di repere, lui ha i suoi punti di repere, ci mette un attimo.